SWIFT Prime was a global study looking at the solitary stent retriever, a device to pull clots out of blocked arteries in patients with acute ischemic stroke within 6 hours of onset. So in SWIFT Prime, we took 196 patients and randomized them. Half received the standard treatment with the clot dissolving medicine TPA, and the other half received TPA plus the stent retriever therapy, where they were brought to the cath lab and a thin tube was placed in the leg artery, advanced to the brain, and the mesh was engaged with the clot to entangle with the clot and pull the clot out of the artery like pulling a cork out of a wine bottle. The primary outcome was the degree of patient disability 3 months after stroke. The device was highly effective. 88% of the patients in whom it was placed, the device was able to substantially reopen the blocked artery. And as a result, patients had much better outcomes. The rate of being independent 3 months after stroke with just TPA was only 35%. And if you got the stent retriever, it was 60%. Overall, 1 in every 2.5 patients treated had a better outcome with the stent retriever, and 1 in 4 patients had an independent outcome if they were treated with the stent retriever on top of TPA. Well, the retrievers were invented actually at UCLA in the early 2000s by a French neuroradiologist. So I don't think it's an accident that the idea of pulling a cork-like plot out of the wine bottle was the approach that he took. And the first generation coil retrievers worked somewhat, but were only modestly effective in getting the clots out, and as a result, they were not proven to be better than medical therapy. That's why it's so exciting that the newest generation stent retrievers have been developed. These are able to engage with the clot much more effectively and pull the clot out much more often. And as a result, we're now in a new era of highly effective recanalization therapy for stroke, where we can get the clot out in 90% of patients. This is the start of a new era in stroke here. We, till now, only had IV TPA as our only proven therapy. That was developed 20 years ago. So this is the first time in a generation, since 20 years ago, that we have another proven therapy, even better than TPA alone for stroke.